Well, it's great to be back here. I I grew up here, and I went to Greenfield High School and graduated in 1975, and went in the military for 4 years, and then came to school here for 3 years before I went to Brandeis and then to UMass and on to my own practice. But I've always, I have such great memories of growing up here. And living in the city in Amherst, and near Boston, I tell them about the things that I did growing up here, and people just look at me like, really? Because I picked tobacco in South Deerfield, and I floated down the Green River on an inner tube. So I have a lot of fond memories. So today I'm going to talk a little bit about gender identity and expression, a little bit about medical issues related to that. And then my friend Joanna Frost is a psychotherapist. She's going to talk, and Jenny Beeman runs the Stonewall Center at UMass, and so she's going to give us some of her input into GLBT issues in the area. And thank you so much for that beautiful introduction. So let's see. So you always have to have a slide like this when you start off. So I never set out to change the world or anything. I just want to ride a bike. And Michelle Demarisk is a championship mountain bike racer from Canada. She's also a transsexual. And then I had put that in. The main obstacle to understanding our own sexuality is realizing that we're all prisoners of past societal attitudes towards sexuality. And this was written by Vern Bulow in 1976. And I love starting my slides with this because I think it's such a good introductory slide. If you think back historically, St. Augustine in 350 AD, I think, sort of set Christian doctrine, and he felt that the only reason for marriage was procreation. And a lot of our cultural beliefs go back to those ancient times. We really didn't understand how a baby was born, or how a fetus, became a baby until the 1800s, 1900s. The whole process was really not very well understood. The theory of menstruation was around 1920. Estrogen was discovered in 1929, testosterone 1935. So it really wasn't that long ago. I like to start with just some definitions because that way we're all sort of in the same place. But sex is a biological term. It's kind of what our plumbing is. It's the way you look physically and the way you appear. Gender is more of a cultural term, and whether you're male or female, or whether you abide by sort of the gender rules of being male or female, kind of depend on where you live, what part of the world you're in, what century you're in. It's interesting that I went to Europe a few years ago, and a lot of the paintings there show the boys in pink and the girls in blue. And that's really how people dressed back then. It wasn't until the late 1800s that the colors switched. I read about it once and I forgot, but if you Google it, there's a whole explanation of what happened. Yeah. So these are just some other terms. Assigned sex at birth is the sex that the doctor gives you in the nursery. Gender identity is the way the person feels about themselves, whether they consider themselves male or female. Gender role is the behaviors that are associated with being male or female. And sexual orientation is the sex of preferred erotic partner. For most people, those three terms all line up. And if a person is female and they feel feminine and their sexual partner is male, that's sort of typical. But you can have a gender identity that's female, say, but your birth sex is male, and you may be attracted to men or you may be attracted to women. As we go on in these slides, I'm going to try to show that it's possible that a lot of this is biological. And transgender is just a term we use to describe a diverse group of individuals who cross that cultural boundary. They can differ in various degrees from the sex they were assigned to at birth. And that's this is a transgender umbrella. And these are all various groups that at some point feel they're part of this group or considered part of the GLBT community. Transsexuals generally feel like they want to be the other sex. They really have a strong identity to the other sex as far as wanting to be that person. People who cross-dress generally don't want to change their sex. They just enjoy adorning themselves, or they enjoy, if they're female, they just enjoy rough and tough play and would rather wear, clothes of the opposite gender. And so genderqueer, that's sort of a term that the younger population has been using a lot. And so being transgender doesn't mean you're gay. It's all about gender identity and really doesn't have anything to do with sexual preference. We're going to talk a little bit more about what the definition of a transsexual person is. And transsexual males, in our office, I have a physician's office in Amherst, New Hampshire, and we have quite a few transgender people that come to see us, and they get hormone therapy, and we refer them out to counseling. And they like to most of them like to be referred to as trans men, and the transsexual women usually like to be referred to as trans women. Disorders of sexual development, that's a new term. We used to use the term intersex a lot, and before that they used hermaphrodite, but this is the newer term that various organizations are trying to promote. Joanna and I both belong to the World Professional Association for Transgender Health, and it's a global group of professionals and doctors that meet every 2 years in a different country and discuss sexuality. And gender conformity and gender diversity are, as these definitions describe up here. And gender dysphoria just refers to feeling discomfort or distress with the gender you were assigned at birth. A lot of the trans guys that I have, for them it's like they hate the fact that they have to sit down to use the toilet. They want to be able to stand up. And for this gentleman, this is Magnus Hirschfeld. He was famous because in the early 1900s, he was a wealthy obstetrician. And he was one of the first sexologists, and he started the Sexual Institute of Science in Berlin. And what's interesting about him, and I really like reading about this time period, was this was when everybody was migrating to cities. And so prior to when the Industrial Revolution and when there were a lot of people in cities and people were mainly in small villages and towns, if you were transgender, there wasn't really a way for you to communicate with other people that had any kind of difference in gender identity or expression. And so a lot of people in Berlin, as Berlin was becoming a more scientific center, would find each other, and they would meet in bars and clubs. And Magnus Hirschfeld would go around and study these people. And in Germany at that time, if you were a man and you were in a dress and you were outside, you'd get arrested. But he would go around and try to petition these people to be released from prison so that he could study them and show that they weren't a threat to society. Before the Nazis came to power, he really helped foster acceptance of gender variant people. And if you lived back then in the 1920s, you would have probably known who he was because he traveled all over the world. He was in major newspapers. This was a big topic back then, just like it is now. And then, of course, when Hitler came to power, he basically burned books and destroyed the Institute, and so this is them burning the books at the Institute of Sexology. Harry Benjamin is another famous person. He was an endocrinologist, and he lived back in this time as well. He and Magnus Hirschfeld used to travel around together and, again, study these folks. And he and Havelock Ellis and Albert Moll and Margaret Sanger, they were all early sexologists. And he came to this country in 1914 and set up a practice. He used to see patients in his office for $2 a visit and $6 for a house call. And he lived in the back room of his office. And he was one of the first doctors that actually treated transgendered people and transsexual people. And at that time, this terminology of transsexual, transgender wasn't even really around. He sort of coined the name transsexual in 1966 when he wrote The Transsexual Phenomenon. And the big question is whether gender variance is physiological or psychological or organic. So it's a nature versus nurture argument. So there's a lot of people that believe that how you're reared by your parents helps determine whether your gender identity is male or female. And then there's other people like myself that feel it's a biological phenomenon. And the theories have gone through various cycles throughout the last 100 years. When they first discovered estrogen and testosterone, they really thought maybe there was more of a biological role for gender expression. But what they found was that people with high testosterones didn't necessarily have strong masculine feelings, and people with high estrogen levels didn't always feel like they were strongly feminine. So in the 60s and 70s, there was much more of a push towards this being more related to the way you were brought up and whether your family dynamics affected the way that you grew up. But it seems now that most people are thinking more along a biological possibility. And so I won't go into that. This is Rebecca Allison. She's the president of the Gay Lesbian Medical Association. And Wendy Carlos, and she helped compose Clockwork Orange. And Billy Tipton was a jazz musician in the 1950s. Lynn Conway was a computer scientist. Stephen Whittle is a law professor in the United Kingdom. And Jennifer Boylan is a English professor at Colby College. And Terry O'Connell is a race car driver. And what all these people have in common is that they're all transsexuals. And in some cultures, shamans and medicine men are felt to be highly revered because they understand both genders. You see this in some African tribes and some older American tribes. So just some commonalities. thoughts of being the wrong gender usually start in childhood. We have about 70 transgender people that come to my office, and almost every one of them will tell me, I felt this way since I was 6 years old, and that's just a common theme. A lot of the male to female transsexuals have been in the military. It's a way to overcompensate for what you feel like you should be. I mean, I went in the Air Force after high school, and part of that was because I wanted to be this masculine person that, I wanted my father to be proud of me, and I wanted my family to be proud of me, but it never quite worked for me. But that's a common theme, though. Purging is common, and that's not vomiting. That's usually what that is it's for trans women, they'll collect articles of clothing and jewelry, and then they'll get so upset with themselves about the way they think, and they'll throw them all away, and then 2 weeks later they find themselves collecting them again. So a lot of times some of the questions I'll ask a new patient who comes to see me, usually they're scared. They'll come in the office and they're really kind of like, well, I found you on the internet and I don't quite know what to say. And first thing I'll say is, well, what's your other name? Because they almost always have another name. If they're a trans woman, they usually have a female name. Trans guy, they usually have a male name. And they'll go, how did you know I had another name? I'm like, I just know. And then I'll say, did you ever put your clothes in a plastic bag and throw them away? And they almost invariably look at me like, how did you know that? So it's just very common. Anxiety and depression are common, and Joanna's going to talk about that. There's a big difference between children and adolescents versus adults with gender dysphoria. Almost all adults that will come to see me that are, say, 40 to 60, that age group, they almost always are pretty sure they want what they want. If they want to change sexes, they're almost always positive that's what they want. You have to be a little careful with children. When I see children in the office, I'm much more cautious with them because the statistics show that only 1 in 5 kids actually will go on to still feel gender dysphoric when they get into their 20s and 30s. So we don't rush to put them on hormones if they come in. We sometimes put them on puberty blockers so that we give them a chance to figure out who they want to be and block their puberty until they're ready to go through it. This is Lily Elbe. She was one of the first people to have transsexual surgery, and it was 1930, and she had the surgery in Germany, and she was an artist in Denmark. She ended up having a number of surgeries and dying from complications of a uterus transplant because she wanted to have a baby. And then Christine Jorgensen came along in the 1950s and really sensationalized transsexual people. They used to have newspaper clippings with GI becomes blonde bombshell. And I just wanted to show you quickly that estrogen and testosterone are very, very similar chemicals. They only differ by 4 atoms of hydrogen and 1 of carbon. And yet, our brains are exposed to these hormones all the time, and they can create very different behaviors in us. I'm going to skip some of these because I don't want to take too long. This slide's just supposed to show that the hormone milieu that you're exposed to when you're a fetus may imprint your gender identity or expression, so that if you believe in the biological theory for gender identity and expression, it may come about in utero. And so since there are hundreds of chemical reactions occurring in genes and proteins made during pregnancy, it's very possible that some sort of imbalance contributes to gender identity and expression, such that the brain feels female, but the body comes out male, or vice versa, and then the person just struggles for years and years, like I did, and Joanna did, and Jenny did, but it's getting easier, because kids coming along now, there's a lot more publicity about this. They learn about it at a younger age, and hopefully they'll be able to transition much younger than, say, I did or Joanna did, and life will be easier for them. The other thing, too, is that the gonads and the ovaries and the testes, they develop in the first trimester, and the brain develops in the third trimester. So as these hormones are being produced by the fetus from the first trimester, if there's some kind of error in the biological messaging, and the brain has this abundance of hormone receptors for estrogen and testosterone, you can see how a brain could be sexed female, whereas the appearance of the person is male, or vice versa. And since you can't see the brain, you can't see the birth defect that's there. But I would say that all three of us feel like we were born with a birth defect. It's just, if you have a missing arm, or your heart is born with a problem, I mean, those things are easier for people to understand than my brain is sexed differently than it's my body. And are male and female brains different? Well, they are. This is just showing you that certain parts of the brain are larger in women versus men. And women generally have smaller brains than men, but that doesn't mean that they're not as smart as men, because the density of nerves is different in different places in the brain, and the density is, for instance, in the temporal lobe of the brain, women have many more neurons than men do, and they tend to color their language. Women generally have more vocabulary than men do. Hippocampus is just a part of the brain in the limbic system, and it is different in women than men, and it's felt to be related to spatial mapping. So women tend to navigate by landmarks. They remember where they're going because they think about landmarks. Men travel by distance, and it may be related to these differences in the brain. The amygdala is another organ in the limbic system, which has been shown to be different in men versus women. And the amygdala handles emotional memories. And I'm going to skip some of this, but this slide basically just shows that many types of diseases are more often to occur in men versus women. For instance, anorexia nervosa, like 93% of people who have that disease are female, whereas schizophrenia is much more common in men. So do we define sex by chromosomes, whether you have an X or a Y chromosome? Do we define it by whether you have testes or ovaries? Is it related to genes that are produced? Is it whether you have breasts or you don't have breasts, whether you have a penis or a vagina? Is it related to how much testosterone or estrogen you have? Because we all have a little bit of both. It's just that the proportions are different. Or is it due to sex of rearing, where your parents bring you up? If you're born with what they call ambiguous genitalia, and the doctor comes into the nursery and says, well, let's raise this baby as a boy, but maybe the baby's brain really feels female, how much influence does sex of rearing have on us? And then, of course, gender identity. This is kind of a cool slide. You know that that's Burt Lancaster on the left, and you know that that's Grace Kelly on the right, but why do you know that? It's all subconscious cues. If you look at Burt Lancaster's forehead, he has like a dimple in his forehead. His forehead's probably 6.5 to 7 centimeters in diameter. He has sort of a bony prominence over his eyebrows. His lip is longer, and so you can't see his teeth, Whereas in a woman, when a woman smiles, you almost always can see their teeth because they have a shorter upper lip, they have a flat forehead. Their forehead's usually 6 centimeters or less. The nose tips up in women a lot of times and tips down in men. Men have wider chins and jaws. And men are generally taller, they have bigger hands, bigger feet, they have deeper voices. So there's a lot of things that we look at when I think whenever we see another person, we size them up as to whether or not they would be a sexual mate. And we're doing that subconsciously because it's all about propagation of the species. So when we see someone with some of these features, we know that that's a masculine person, or that's a man, or that's a woman. And that's a picture of Johnny Depp. If we did facial feminization surgery on Johnny Depp, we can make him look like he's a girl. Or if we took Kate Winslet and we can masculinize her. It's just a little bit about the Olympics, because over the years that's always been a big topic, and I could do a whole talk on the Olympics because they're always trying to figure out what the best approach is so that they don't allow someone to participate who would have an advantage. So currently, if you're a transsexual person and you've had surgery, after 2 years of being on hormones, say estrogen, you can compete with the women, but they won't let you compete until you've been 2 years out of past surgery. There's also chemicals in our environment that may be contributory to why we're seeing so many more people that are gender variant and more people. Is it because more people are willing to come out and talk, like myself, or is it that there are chemicals in the environment that are creating more of us? I don't think we know the answers to that. But this chemical, diethylstilbestrol, that was a chemical that was introduced in the 1930s and 40s, and it was given to women for all kinds of reasons. They weren't told why they were getting it sometimes. They included it in vitamins. It's a form of estrogen, and they used it to try to prevent miscarriages and menstrual irregularities. And what we found when I was going through medical school, one of the things we talked about was women who were exposed to DES mothers often had a higher risk for cervical cancer. So we were always taught to, talk to women. Do you know if your mother got DES when she was pregnant? Or if you saw an abnormality when you did a pap smear, were you DES exposed? But we were never taught much about the boys that got DES exposed. And a few years ago, there was a large group of boys that found each other through the internet and learned that they had all been exposed to DES, and they had that in common. And what was interesting was that almost 25% of them felt they had a gender dysphoric problem. And that's much more than the general population. So it goes back to that biological theory that maybe something in the chemical milieu when you're a fetus contributes to your gender identity. And I'm just going to sort of end now, but I just want to talk a couple of things. This is kind of the things that in my office, what we do. When somebody comes in with gender dysphoria, first I just have to relieve their fears and tell them they're in a good place, and that they can talk to me about this, and they're usually amazed that I have so many other patients with this condition. And we often have to get them into psychological counseling because there's usually family dynamics and workplace issues that come up, and so it's good for them to have a therapist. We eventually end up talking about hormone therapy and surgery, and then I asterisk name change and gender markers because they're such big issues for them. Getting to change your name or getting to change your gender marker on your driver's license is huge for them. And these are some of the barriers that I see, and there's a lot of bias by providers. Some healthcare providers won't take people with gender dysphoria. They don't want them in their waiting room because they're afraid to scare off other patients. Fears of being outed to employers, losing your job. In New Hampshire, we still don't have gender identity and expression in the anti-discrimination laws. So you can lose your job in New Hampshire based on gender dysphoria, and there's not much you can do about it other than argue that you have a disability from a mental health standpoint. But most of us don't believe that it's really a mental health issue. Hate crimes, they're much more common in the transgender population. They're typically very violent. Fear of law enforcement. I give my transgendered patients a letter to keep in their glove compartment that says that they're being seen by a doctor and they're being supervised and for their hormone therapy. And because if they get stopped and they're wearing a wig and a woman's dress and they don't really look that female, policemen really give them a hard time. It's getting better, but I think it's good for them to still have that letter. Depression and suicide is quite high. Substance abuse, HIV and other STDs, a lot of them can't find work. So in big cities like New York and Los Angeles, a lot of them work in the sex industry just because they need to make a living. And so they're much more susceptible to those infections. But this is the last couple of slides. This is what I wanted to show you. These are by Sarah Wong on her website. These are all trans kids. It's a whole new generation of people coming through. And, if we catch them early enough and we know that they're gender dysphoric and they talk to their parents and they see a doctor, we can put them on those hormone blockers and buy them time to let them really decide who they want to be. And then if they continue to want to change their sex, then they can go ahead and get on hormone therapy. But it's these kids are our future. And so instead of people like myself who struggle coming out in their 40s and 50s, I think what we're going to see as time goes on is kids coming out 13, 14, 10 years old, and it's going to be a much different life for them. So that's all I have.